5 on your health, and we've learned that polio has been found in wastewater in New York City, suggesting the virus is circulating.
Here to answer your questions is Dr. Simone Wilds, of course, an infectious disease expert at South Shore Health. And we always appreciate you coming on with us and talking about issues like this, Dr. Wilds. Polio was a scourge in this country, but not for decades. Why are we seeing this right now?
Maria, you're correct. I think we can all recall seeing pictures of people in the 1940s and 50s wearing braces, and they had polio. We got vaccines, and by 1979, we had no cases of polio. Right now, we're seeing cases in those that are unvaccinated and under-vaccinated. The cases in New York, we've heard about one, but I'm sure there's probably going to be others. And there's also cases in London. So I think we really have to stay tuned about what's happening with polio right now in this country.
Yeah, well, talking about that one case in New York, Dr. Wilds, the wastewater discovery, it came about 3 weeks after that man, a man in Rockland County, New York, was diagnosed, and he was left with paralysis. Not everyone, though, who's infected actually develops symptoms, correct?
Yes, you're correct, Erica. 70% of the cases have no visible symptoms, but I will point out that 25% of individuals get flu-like symptoms, and that could be fever, headaches, you could get fatigue, you could get stomach pain, and then there's that less than 1% of individuals that end up with paralysis. They could get infection of the brain and spinal cord causing meningitis. And they can also have sensation of pins and needles in their hands. So, that 1% is really concerning. And of course, you can also have some individuals that die.
Doctor, there was a massive vaccination campaign in this country to stamp out polio, but there are concerns that the pandemic slowed down vaccination rates. So what should parents know about all of this?
Yes, I think the pandemic has really created such an upheaval in all our lives in many different areas. And I think one of the areas that we've seen it is routine vaccinations. As a mother, as an infectious disease physician, I wouldn't want my child to have polio or any other child, particularly if they end up with the complications such as paralysis. So I would say to anyone who has not been vaccinated, or if they've missed their doses because of the pandemic or any other reason, especially now that we're hearing about cases, I'd like to encourage you to go ahead, get vaccinated. We want you all to be safe and healthy.
Yeah, maybe double check your status. Dr. Simone Wilds from South Shore Health, thanks so much for joining us.
Thank you, doctor. Stay well.